marking a year of hostilities and ongoing violence in Gaza and the occupied West Bank. Millions of Palestinians struggle to live under the Israeli occupation. The ongoing war marks a perpetual humanitarian disaster for Palestinians in Gaza. Ever since the onslaught of October 7th last year, over 41,000 Palestinians have been reported killed and over 96,000 injured. Palestinians have been displaced around 10 times, each time seeking shelter in different tents in various parts of the enclave. With almost 2 million displaced in Gaza, according to a UN estimation, Israeli aerial, land and maritime bombardments continues, resulting in further civilian casualties, displacement and destruction of houses and other civilian infrastructure. A lack of medical supplies, food, water and fuel has depleted an already under-resourced health system, with Gaza's remaining hospitals and medical facilities struggling under the strain of patient numbers and medical staff. Only around 1,500 hospital beds in Gaza remain operational, where in comparison cities of similar size, such as Chicago and Paris, average 5 to 8 times more beds than in Gaza. The Israeli blockade is exacerbating the crisis, and the humanitarian disaster is at the brink as the entire population of Gaza faces hunger and disease. Almost 500,000 are at risk of starvation, with 96% of the population facing acute levels of food insecurity. 83% of required food aid does not make it into Gaza, marking Gazans having an average of 1 meal every other day. As winter months are approaching, displaced Palestinians fear that the upcoming winter and ensuing rainfall will bring misery to those housed in worn-out makeshift tents. The UN humanitarian agency reported almost 1.13 million people need emergency kits for makeshift shelters or tents, and 1.38 million people need bedding kits. While urgent needs persist in the Strip, the limited access to Gaza, due to the obstruction of Israeli offensive forces, continues to affect hundreds of thousands of Palestinians, including vulnerable people, leaving them in dire conditions with a severe shortage of essential supplies and restricted access to basic services.